Okay.
Thank you, Karina. So, good morning, good afternoon, good evening to all the students. Today it's our last discussion in the winter school on tropical medicine, and we will discuss a patient with hepatitis C chronic infection. I will share my screen to you. Just a minute. The this 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 discussion is in Portuguese, but I will translate to you. So this is a 47 years old woman, uh, white skin, that work with domestic working in your home. She was she lives actually in a city near Botucatu called São Manuel, and this woman was observed in August 2019. She was detected with hepatitis C infection, uh, serology positive after she tried to give blood to a donation. So she was at that time completely asymptomatic, without any changing in his health, and because she wanted to give blood, to donate blood, you know, we have to perform a lot of serologic tests uh, with intention to detect some blood transmitted disease like HIV, hepatitis B, hepatitis C, syphilis, and also HELV. So she was detected at the first time with serology positive for hepatitis C. She never did this test yet at this time, for 3 years ago. And like I said, she was completely asymptomatic without any complaints about her health. Okay? Well, moving to the family and the personal history, she didn't know about children disease, and never had symptoms like yellow skin, like ictericia in the past, and she didn't know about the 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 vaccine that she received when she was young. Like I said, she worked at home, and the unique sexual partner that she had is actually his husband, and she never had a infection transmitted sexual transmitted disease. She also never used illicit drugs like cocaine, like crack, like heroin, or any other one, and the same relation in the husband. But she told us that when she delivered his first child 28 years ago, so almost 3 decades ago, she received a bloody transfusion because when in the labor she lost a lot of blood, so she received a big amount of blood because the loss of blood in the labor. We can figure out that this episode occurs uh, at the beginning, in the end of the 1980s year to the beginning of the 1990 years. Well, she has three sons, everyone with good health, and his husband has obesity, hypertension, and also diabetes. She never used alcohol or smoking. Okay? Well, when we saw this woman in this first time, she had no alteration in the physical examination. She is completely normal without any findings, and we look for some blood test trying to confirm the hepatitis C infection, because the serology test that is performed in the screening, in the initial screening for a lot of disease, serologic test detects the presence of antibodies. Okay, so antibodies is not the same as the pathogen, the virus or the bacteria or the other pathogen. So in specifically talking about hepatitis C, we know that you can have the infection, the first infection, the acute infection by hepatitis C virus, and at least 15 to 20% of all the patients that have contact with the hepatitis C virus can eliminate the virus in the acute phase. So the immunological system of this patient can eradicate, can cure the patient in the first contact. So in this patient that can solve the problem, they don't develop a chronic infection, but the serologic test remains positive all the life, because this is the maker, this is the antibody that show that one day in the past this person had contact with the virus. Okay, but when you are not able to do this, to do the clearance of hepatitis C virus, you develop the chronic infection, and so you have to look for all the patients with serological test positive for hepatitis C. You have to look for the virus presence. So this is the reason why we performed the PCR, the polymerase chain reaction, trying to look for the RNA of the hepatitis C virus, because if this test is negative, okay, no problem, it's very good. Patient had the contact because the serologic test antibodies is positive, but there is no more virus. This patient could eliminate by himself the infection. It's very good. Like I said to you, 15 to 20%. But this patient, unfortunately, developed a chronic infection. You can see here a very high level of virus in the plasma, 600, almost 700,000 copies per ml. Okay, so when you have this result, you can do the diagnostic of hepatitis C chronic infection, because this patient was not able to eradicate to do the clearance of the virus. So this is a problem because the virus can continuous inducing the fibrosis in the liver because the virus replicate in the liver and it can cause evolution in terms of hepatic fibrosis, like liver fibrosis. When you have the virus in the liver, the virus induce some immune response that can go, that can put high levels of the transaminase, and it is the marker of the inflammation of the liver. And after 2 decades or 3 decades, the uh, fibrosis accumulation can be generate cirrhosis. That is the end of the story. When you lost all the hepatocytes that do the work of the liver, you have no more hepatocytes, good hepatocytes, and it is replaced by fibrosis. And when you lost almost all the hepatocytes, you we call it cirrhosis. Okay, so this patient has had the diagnosis of hepatitis C chronic infection because the PCR was positive, and also we performed the genotyping of the virus because you can have 6 different genotype of hepatitis C virus. So you we call it genotype 1, 2, 3, 4, 5, and 6. It's very important to know what kind of genotype is the virus of the patient, because some drugs works only, for example, to genotype 1 and 4, and other ones work better for other genotype. But nowadays, we have good drugs that we call it pan-genotyping, so work for every genotype. Nowadays, I think in the next 1 or 2 years, we will not use the genotyping anymore because the drugs, the antivirus against hepatitis C virus that we have now, it works well for any kind of hepatitis C genotype. You understand? But at that time, we didn't have good pan-genotype drugs, so we performed the genotyping. Genotyping of this patient is 1B. And of course, because this patient received blood transfusion in the past, we had to look for about other blood transmitted disease, like for example, HIV, hepatitis B, and syphilis. Okay, all these serologies was negative, so she was infected in a past blood transfusion about 3 decades ago. And you can see here the level of alamino transaminase, or ALT, also known as TGP, is high for her because the normal range, the normal level of TGP or ALT is 30 to human, for human, and she had 49. Okay, the albumin is normal, and the coagulation rate also was normal. And we performed here a special test to look for the level of fibrosis. Like I said to you, the big problem with hepatitis B chronic infection, and also hepatitis C and hepatitis B chronic infection is the inflammation, the chronic inflammation. You are not able to do the clearance of the virus, and because the virus can replicate in the liver, the immune system every day do a lot of inflammation, and this inflammation can develop the increase of fibrosis in the liver, and a lot of fibrosis, like I said, it called cirrhosis. And this kind of test called liver elastography or hepatic elastography can show to us what is the level of fibrosis. The gold standard, not really a gold standard, but the most accurate test to see the grade of fibrosis, the level of fibrosis, is the hepatic biopsy. But the hepatic biopsy, the liver biopsy, is very painful and maybe a little bit dangerous because you can promote a bleeding in the liver, or even when you do the biopsy, you can reach the lung. So it's very accurate because you you pick up a piece of a little fragment of liver to examine it in the microscopy, but it's not a harmful, completely harmful test. And the liver elastography or hepatic elastography is a test without, it's not invasive. It's completely friendly because it's like an ultrasound with a probe. You put the probe next to the liver. You don't have an image really, but the ultrasound waves can show if the liver has a little fibrosis or more fibrosis. And you have you discover a number that you could correlate to the level of fibrosis. Okay, so it's a very good test that can substitute at all the liver biopsy. So we performed here the hepatic elastography, and it's not a surprise to us. The level of the hepatic fibrosis for her was 2. What it means? When you don't have any problem with hepatitis B or hepatitis C or alcohol or liver steatosis, you don't have, the liver is completely free of fibrosis. So the grade is 0. When the liver is completely normal, you said 0 fibrosis. Very good. When it becomes to increase, a little bit of fibrosis, number 1, level 1, moderate fibrosis, number 2, a lot of fibrosis, almost doing a cirrhosis nodal, you call it level 3. When you have the completely circle of the cirrhotic nodules, you call it 4. Level 4 is the maximum and is the same as cirrhosis, hepatic cirrhosis. Okay? So this patient had the moderate level because she lived with the hepatitis C virus during 2 or 3 decades, starting when she received the blood transfusion in the past. And you can see that the ultrasound is not useful to see fibrosis. The ultrasound is not accurate it cannot show to us the level of fibrosis. The reason why we performed the ultrasound is to look for hepatic nodules, but related to hepatocarcinoma. You know, a cancer in the liver, the most important cancer in the liver is the hepatocarcinoma. The hepatocarcinoma is a complication that we can find in hepatitis B or even in hepatitis C infection or other condition like a high intake of alcohol and other condition. Okay, so this is the how we can do all the classification of patient. You understand? We confirmed the hepatitis C chronic infection. This is very important. This is our first task, first action to do. And we discovered that she had grade 2 fibrosis, and now we have to do something. Well, what you have to do? You have to treat. Because nowadays the treatment can actually cure almost or very close to 100% of our patients. The treatment is, the indication of treatment is universal. You have to treat all the hepatitis C patient because the treatment is very easy to be done. It's just one pill a day for 8 to 12 weeks. So very easy, without no side effects. And like I said to you, the rate of success is very high, very close to 100% for all the patients. And how we do the treatment. So we look for the drugs. In her case, we use the combination between sofosbuvir. Sofosbuvir is a polymerase 4B inhibitor, and ledirpasvir. Ledirpasvir is also a polymerase inhibitor, but is against the N5A polymerase. Okay, so a combination between two different classes of drugs, but just in one pill for 8 weeks. So it's a very short treatment. Okay, without any kind of side effects. Very friendly to the patient. It's just to take one pill for 8 weeks. No big deal. And you can see here, after the 8 weeks, the PCR, the RNA PCR becomes negative. She had a very high level, almost 700,000 copies per ml. After the treatment, in the last day of the treatment, negative. But you can think, wow, the PCR is negative, but the virus can replicate, can be hiding somewhere. You can have the failure of treatment, the recidivity is right. But like I said, the failure is very uncommon, less than 1%. So what we do in the routine is to repeat in 3 and 6 months after the end of treatment the PCR. And like you say, like you see here, after 3 months the PCR remains negative. After 6 months, this is the final moment when you have to test the patient. The PCR remains negative. When you wait for 3 for 6 months without any replication of the virus, you can you can assume that the virus is, is extinct, is completely cured, a sterilization actually of the patient. So this is a really cure of the disease because the hepatitis C virus cannot integrate in the human genome. It's different, for example, when you compare to HIV or hepatitis B virus, because HIV and hepatitis B virus integrate their genomes on the host cells, on the human cells, on the DNA of the host. And the hepatitis C virus uh, don't do this step in the cycle of replication. All the replication of the hepatitis C virus is it occurs in the cytoplasm of the hepatocytes. So when you can eliminate all the virus that is in the blood, you also promote a sterilization, a cure of the patient. And this what we call it sustained virological response in English. Sustained virological response. This is the cure. And you can say goodbye to your patient. There is no reason to continue the medical follow-up because the disease actually is cured. Okay? And in this patient, you saw that the level of fibrosis is moderate. So there is no problem to live with this level of fibrosis. Actually, probably in the next 5 to 10 years, this fibrosis can be uh, slowly removed and replaced by new hepatocytic cells. Well, probably in 5 years or 10 years, the level of fibrosis can decrease to 1 or even to 0. Don't You don't have to do the follow-up to see it because there is no clinical or laboratory changes in her life. Okay? When you discover later the infection, thinking about a cirrhotic patient with grade 4. So when patient is cured, is treated with sustained virological response, you have to do the follow-up because the patient has cirrhosis, and cirrhosis can have some complication. And when this type of patient uh, uh, is treated by us, infectious disease medical doctor, after the treatment, we send the patient to the hepatologist, the physician that treat cirrhotic patient, to the hepatologist, perform the follow-up of the patient. Okay, so I think we finished the presentation. I will I interrupt my sharing and we can discuss now. If you have some doubt or some comment, please use the microphone or use the chat to begin in our discussion. Hi, Jimena.
Hi, doctor. You mentioned in your presentation that liver biopsy, although it is the gold standard, it shouldn't be routinely done. But in your opinion, in what cases should it be like taken the test?
Very good question, Jimena. But I think you saw that I interrupted when I start to say gold standard. Actually, it's not a gold standard. Was in the past a gold standard because, like I said, it's very painful and could be dangerous. I saw a lot of pneumothorax, air in the lung, because physician put the biopsy in the lung and the lung explodes. It's not good. It's very dangerous. So the hepatic elastography is easier, is actually very quickly, in less than 5 minutes. But I have to answer your question. The liver biopsy is very important to other conditions, not to see the level of fibrosis. It can be replaced, like I showed to you, using the elastography. But for example, when imagine if we discover in the ultrasound a suspicious noodle in the liver, we suspicion, like for example, a hepatocarcinoma. So in this case, you have to perform the liver biopsy because you have to understand if the noodle in the ultrasound is a cancer, is a neoplasm or not. Okay, so the liver biopsy is mandatory, is completely necessary to do the diagnostic of suspicious case of cancer and also to steatosis. I think you know, everyone know what is steatosis. Steatosis is fat in the liver, uh, and fat in the liver can also develop cirrhosis if you accumulate it in many years. So to do the final diagnostic of cancer and hepatic steatosis, you have to perform the liver biopsy, but not like I showed to you the level of fibrosis in hepatitis B or even hepatitis C. Okay, Jimena, in, Me-
Yes.
in Mexico, do you do you do you have this kind of test, elastography? You ever?
To, to be honest, I don't know. I've never heard of it, but I bet in like the major institutes they implement this test.
Yes, it's a very good. It's a machine like the ultrasound, but you don't have the image. You put the probe in the liver, and it's like a video game. It's very easy. You have the probe. The probe is like a pen, like this pen. I put it in the surface of the liver without any any invasive, just to put close in the skin, and you apply 10 waves of ultrasound that goes inside the liver and return in the probe, and you have the measure of this wave. If this wave is very quickly, you have no you have no obstacles, it's, you have no fibrosis. So the ultrasound waves goes and return very quickly. So you'll know that there is no fibrosis, level 0 or level 1. But when the waves become more high, you know that's a lot of obstacles, a lot of problems, so a lot of fibrosis, and you can have, for example, level 3 or level 4. You understand? It's a very good non-invasive test to perform and so the evaluation of fibrosis in the liver.
Yes, we have it, the elastography, at least in a general hospital in Mexico City,
Uh,
in Hospital General de Mexico.
you ever see this test is performing, AB?
Can you
AB? AB? Do, do you follow some patient doing this test?
Patient, but I haven't.
Are you familiar?
No, no, no. I was in a rotation. I was just a viewer.
Okay, perfect. Any other question? So, Jimena, do you have other question?
Yeah, sorry. As to, I don't know, maybe IV drug users or people who have to go under hemodialysis, is there like a screening, like a universal screening program in Brazil, or who
Yeah.
is subjected to?
Uh, Another very good question, Jimena. Actually, there is some population that is more vulnerable, that you can find easier the hepatitis C infection. So you have to look very carefully and test and test and test again and repeat the test. For example, in IV drug users or uh, sex worker or male that have sex with male population, and like you refer, hemodialytic patient. But you have to understand also that the serologic test is very cheap and very easy, and at least 30 to 40% of all the hepatitis C chronic infection, there is no, you cannot find a route of transmission. So people in the past may they received injection without good sterilization. You know that in the past we don't have plastic syringes or discartable needle. The syringes was done by by uh, it's not recyclable. So the best way is to test everyone at least once in a life. So everyone has to perform not only hepatitis C test, but also HIV, hepatitis B, and syphilis. Okay, and but when you have a very vulnerable population, you have to perform the test repeatedly because people can infected after your test. And I forgot to say, uh, for example, in this case that I showed to you, uh, this patient can be reinfected, if uh, if she is exposed against, because the treatment just uh, clear the actual infection, but you don't develop immunity against the virus. So you have to uh, inform it to the patient. You are clear now, you are cured, but you have to pay attention, trying to avoid a new infection or a reinfection. Okay?
Thank you, doctor.
Please, AB or Abby Gross, can you do your question? If there is no questions. I think there is no more question. So this is our last discussion in our winter school in tropical disease. I have to thank you very much, all the students, for the attention in these last 2 weeks. And I have to thank you very much, Karina, and all the international agency of UNESCO for the support. I think it was a huge opportunity to discuss with students all over the world some important aspect of the tropical disease. So thank you very much, Karina. And the students are asking for the form. The attendance list is here.
So I just thank you, Professor, very much for the wonderful lectures. It was a very nice time with you. And I ask the participants to wait for 5 minutes so that we can start our international party, okay? And you are invited, Professor Alexandre, to stay with us if possible, okay?
I thank you very much for the invitation, but I have to go directly to the airport. I have a flight to
Oh,
in the next 2 hours. But thank you very much. It's a huge pleasure to be with you in these 2 weeks. Bye bye, people.
thank
Bye.
you.
Thank you so much.
Bye, doctor. Thank you for everything.
Thank you, doctor, for the lectures.